Welcome to our brief primer for both faculty and residents on precepting USU medical students during their pediatric clerkship. We deeply appreciate your willingness to dedicate your time and expertise to precepting our medical students. Your commitment is invaluable. Please understand that your influence is profound. Many medical students arrive with varied career aspirations, but it is during their pediatrics clerkship, under your guidance, that they often discover their passion for pediatrics. The Uniformed Services University is located next to the Walter Reed Medical Center. Each year, the USU graduates approximately 175 students. Students are active duty in the Army, Air Force, Navy, Public Health Service, and Coast Guard. They are required to complete 7 years of service after they complete residency. Being a military medical school, we have a variety of students, some who come from the academies, some with prior service, and some completely new to the military. Our clerkship year begins in January of the student's second year, following 18 months of foundational basic science coursework. This year-long clerkship, running from January to December, includes a mandatory 5-week rotation in pediatrics for all students. Additionally, some students will pursue a 4-week elective in pediatric subspecialties within the clerkship year. For many of our students, this pediatrics rotation marks their initial exposure to the unique aspects of pediatric care. Your expertise is crucial in guiding them. Even seemingly minor procedures, such as neonatal rectal temperature measurement, can be entirely new to them. Please share your clinical pearls. Every interaction is an opportunity for impactful education. It is important to note that approximately 1 in 3 USU graduates will have direct responsibility for pediatric patients in their primary duties, whether in pediatrics, family medicine, or emergency medicine. This 5-week rotation may represent their most significant, or only, exposure to pediatrics during their medical school journey. Our pediatric clerkship focuses on several key objectives: cultivating a humanistic approach to patient care. This includes recognizing the diverse factors influencing patient well-being, particularly within our military context, where deployments and other unique circumstances may significantly impact care. Enhancing written and oral communication skills. Pediatrics offers a unique opportunity to train students in effective communication with both parents and children across all developmental stages. Specifically, students will learn to perform the HEADS assessment, a valuable framework applicable to their future work with the military's young active duty population. Mastering age and developmentally appropriate physical examinations. Students will learn to adapt their examination techniques based on the child's cooperation, ensuring a comfortable and informative assessment. A crucial objective of the clerkship is to empower students to synthesize clinical data. This involves integrating information from the patient's history, physical examination, and diagnostic studies to develop comprehensive assessments and management plans. This includes discerning the severity of illness, determining appropriate rehydration strategies, and accurately calculating weight-based medication dosages, as well as evaluate behavioral and developmental milestones. Students will gain proficiency in assessing children's behavioral and developmental stages. Lastly, students are expected to be able to identify exam findings that should raise suspicion for non-accidental trauma. Students must use the clinical tracker to document all clerkship experiences. For each of the 12 required clinical experiences, identified in the tracker's red section, the supervising preceptor must initial to verify student participation. Preceptors are essential in providing constructive feedback to students through 2 key tools: the Clinical Evaluation Survey and the Direct Observation Survey. If you interact with a student in any clinical capacity, please complete a Clinical Evaluation Survey. If you also directly observe the student performing a specific clinical skill or task, please complete a Direct Observation Survey as well. Additionally, students have the opportunity to offer valuable feedback to preceptors through the Student Feedback Survey. This feedback is crucial in recognizing and celebrating excellence in teaching, and it plays a significant role in the determination of teaching awards. The clinical evaluation provides an overall assessment of your experience working with the student, regardless of the duration of your interaction, be it a full week, a day, or a half day. Clinical evaluations are structured around the RIME schema, which represents 4 developmental stages: reporter, interpreter, manager, and educator. Students at the beginning of their clerkship are expected to function as reporters. This includes the ability to gather a comprehensive history, perform a thorough physical examination, collect pertinent diagnostic study results, and present this information in a clear and organized oral presentation. Students who can synthesize clinical data to formulate a differential diagnosis demonstrate the skills of an interpreter. They can explain their reasoning, support their differential with relevant data, for example, understanding lab values like alkaline phosphatase, and provide logical explanations for clinical findings. For example, differentiating eczema flare from bacterial superinfection or eczema herpeticum. By the end of the clerkship year, the typical student will function at the level of an interpreter. To effectively assess their interpretive abilities, Consider asking probing questions regarding their diagnostic reasoning. Students performing at the manager level function akin to interns. They can develop sound diagnostic and therapeutic plans, tailored to individual patients. Managers exhibit consistent patient ownership, including following up on lost lab results, initiating consultations, and providing comprehensive sign-off with appropriate contingency plans. Students who exceed expectations and function as educators demonstrate exceptional initiative. They actively review clinical guidelines and evidence-based practices, integrating them into both patient and team education. When completing the clinical evaluation, we strongly encourage you to comment on the student's performance within each RIME category, in addition to their overall professionalism. Direct observations are crucial for assessing specific clinical skills and tracking student progress throughout the clerkship year. These observations are conducted in every clerkship. Students are required to obtain 5 direct observations per rotation. A direct observation focuses on a specific clinical skill or set of skills, such as history taking, physical examination, or oral case presentation. It involves a checklist of observed behaviors and includes space for a concise summary highlighting the student's strengths and areas for improvement. Direct observations provide immediate feedback to the student after observing a specific task or clinical skill. They can occur in various locations, such as observing a physical exam in pre-rounding or gathering a history in the emergency department. Multiple direct observations can be completed by the same preceptor. This can demonstrate the student's responsiveness to feedback. Completing a direct observation takes less than 5 minutes on average. Consider utilizing dictation tools within SurveyMonkey to streamline the process. Even if you have already completed a clinical evaluation for a student, please provide specific feedback on observed skills through the direct observation survey. Students are provided with a number of resources to help them obtain all of this vital feedback. In addition to the links on their clinical trackers, they can also provide you with a printed clerkship evaluation reminder for you to keep while the student is rotating at your hospital. Be sure to ask the student for this document. To maximize the impact of your feedback, consider the following. Specificity. Instead of general recommendations, provide concrete suggestions. For example, if a student struggles with a patient encounter due to unfamiliarity with otitis media, guide them towards specific resources. Actionable advice. Offer clear and actionable steps for improvement. For instance, suggest relevant journal articles, online resources, or textbook chapters. Constructive language. Frame feedback positively, focusing on areas for growth and development. Timeliness. Provide feedback promptly to reinforce learning and allow for immediate application. By providing targeted and constructive feedback, you play a vital role in shaping students' clinical skills and professional development. Remember to avoid vague statements or those that do not provide specific examples. For example, instead of telling a student to read more, consider telling them, "To enhance your understanding of otitis media, I recommend reviewing the updated clinical practice guidelines from the American Academy of Pediatrics. These guidelines provide detailed information on diagnosis, treatment, and potential complications, which will strengthen your ability to manage similar cases in the future." The Pediatrics Clerkship team at the USU is always here to help. Please reach out to us whenever you have any questions or concerns. Thank you for all that you do. You consistently play an integral role in our students' learning and development. If you are a faculty member and do not have your faculty appointment, please reach out to Angela Johansson to get credit for all the work you are already doing.